So, let's talk about pneumonia. It's a word we've all heard, right? Maybe you even know someone who's had it. But do you really know what's happening inside your body when it takes hold? We're going to dive in and unpack this really common but often misunderstood illness.
Okay, look at this. On the one hand, you've got healthy lungs. Those tiny little air sacs, they're called alveoli, are doing their job perfectly, just passing oxygen into your bloodstream. But then you look at lungs with pneumonia. It's a totally different story. Those same little sacs are now clogged with fluid and gunk. And that means, and this is the key problem, you can't get the oxygen you need. The whole system just gets gummed up.
All right, here's how we're going to tackle this. First up, what is this lung invader? Then we'll get into the anatomy of the infection itself. After that, we'll look at all the different types, how we fight back, and wrap up with the most important part, how you can prevent it. Okay, Section 1, Pneumonia, the lung invader. So let's get right to it. What are we actually talking about here?
So, the official definition is an acute inflammation of the lungs. But let's make that simpler. Just imagine some nasty germ, a bacteria or a virus, is like a burglar. It sneaks past your body's security, sets up shop in your lungs, and just starts causing chaos. And it's especially good at this when your defenses are already a little low.
So who's most at risk? Well, pretty much anyone can get it, but some people are definitely more vulnerable. Think about it. Little kids, their immune systems are still learning the ropes. Older adults, say over 65, their defenses might not be as strong as they used to be. And of course, smokers. They're basically damaging the little cleaning crew inside their lungs. Then you have people with chronic illnesses or weakened immune systems. And for them, fighting off these invaders is a much tougher battle.
You know, it's not all one size fits all. Where you get pneumonia actually matters a lot. Most cases are community acquired. You just pick it up out in the world. But then there's pneumonia you get in a hospital or a clinic. And that, well, that can be a whole different beast. You're often dealing with much nastier, more drug-resistant germs.
All right, Section 2. We know what it is, but how does it actually happen? Let's take a look inside the lungs and see how this invasion plays out.
It's kind of like a 5-act play. Act 1, the pathogen sneaks in. Act 2, it starts multiplying like crazy and releasing toxins. This, of course, triggers your body's alarm system, inflammation. And here's where it gets really messy. All that fluid and junk, we'll talk about exudate in a sec, starts filling up those tiny air sacs. The finale, a total system breakdown. You just can't get the oxygen you need.
Okay, I mentioned that word exudate. What the heck is that? Well, it comes from a Latin word that means to sweat out, which is actually a great way to think about it. It's this thick, soupy mess of protein and cell bits that oozes out of your blood vessels when your body is fighting. Basically, it's the gunk. It's the stuff that clogs the plumbing.
And the infection doesn't always look the same. Think of it this way. Sometimes it's lobar pneumonia, where the infection is neatly contained in just one part of the lung, one lobe. But other times it's bronchopneumonia, and that's more like a splash pattern. It's scattered all over in little patches. That scattered kind is usually more common and, frankly, more serious, especially the ones you pick up in a hospital.
Okay, on to Section 3. Let's meet the culprits, the many faces of pneumonia. Who's behind all this?
The list of causes is, well, it's long. The number one bacterial suspect is a bug called Streptococcus pneumoniae. When it comes to viruses, good old influenza is a huge cause. Then you've got fungal pneumonia. Think Candida, which is a really big deal for people with weakened immune systems. And there's another type that's totally different, aspiration pneumonia. That's not really an infection in the same way. It's more of a plumbing problem. It happens when food or drink or something else goes down the wrong pipe, usually because your gag reflex isn't working right.
So what about walking pneumonia or double pneumonia? I'm sure you've heard those terms. Here's the thing, they're not real medical terms. Walking pneumonia is just slang for a case that's so mild you're still, well, walking around. And double pneumonia, that's just what people say when it's in both lungs. The real term for that is bilateral pneumonia.
Okay, this next part is super important. We know pneumonia is common, so why is it so easy to miss in older adults?
Here's the critical takeaway. An older person with pneumonia might not have the symptoms you'd expect. No high fever, no crazy cough. Instead, the very first sign could be sudden confusion. Or maybe they just seem off, really tired and not themselves. So if you see that, any new confusion or sudden lack of energy, that is a huge red flag. It has to be checked out right away.
All right, Section 4. Time to fight back.
Let's talk about how doctors diagnose and treat this thing.
So, you go to the doctor. You'll probably talk about the usual stuff: fever, chills, pain in your chest, maybe a nasty cough. You might also mention dyspnea. That's just a fancy word for feeling short of breath. Then the doctor will take a listen to your lungs, checking for any crackling or wheezing sounds. But to really know for sure, they'll likely order a chest x-ray to see if there's fluid. And they might take some samples from your cough or your blood to send to the lab and identify the exact germ they're dealing with.
Okay, treatment. If it's bacterial, antibiotics are the go-to weapon. They might also give you things like bronchodilators to help open up your airways, make breathing easier, and expectorants to help you cough up all that gunk. But you gotta be careful, because complications can pop up. You could get pleurisy, which is when the lining of your lungs gets inflamed, and that hurts, or a pleural effusion, where fluid builds up around the lungs. And the absolute worst-case scenario? The infection breaks out of the lungs and gets into your blood. That's sepsis, and it is incredibly dangerous.
Let's talk about one more complication: atelectasis. Sounds complicated, right? But the name, which comes from Greek, literally means imperfect expansion. And that's exactly what it is. It's when a part of your lung, or even the whole thing, collapses because those little air sacs just deflate like tiny balloons, usually because they're blocked by all that junk.
Now, when you're fighting pneumonia, time is everything. You can't just sit around and wait for lab tests, so doctors act fast. They'll start you on what are called broad-spectrum antibiotics. Think of it like using a shotgun. It hits a wide range of potential bad guys. Then, once the lab results come in and they know exactly which bacteria they're fighting, they can switch to a narrow-spectrum antibiotic. That's more like calling in a sniper. It's precise, targeted, and super effective.
And that brings us to our final and honestly most important section. How do we stop this from happening in the first place? Let's talk about your best defense: prevention.
You know the saying, the best defense is a good offense. And the game plan here is actually pretty straightforward. Number one, get your shots. The vaccines for the flu, COVID, and pneumonia itself are huge. If someone you know is stuck in bed, making sure they're coughing and taking deep breaths is a game changer. And then, it's the simple stuff we all know. Wash your hands, take care of your teeth and mouth, and be careful to avoid aspiration.
So really, that's the main takeaway. You don't want to wait until you're sick to think about this. Being proactive is so much better than being reactive. And your most powerful weapons? They're simple things like getting a vaccine and just washing your hands.
So let's just end on this one thought. Your lungs work 24/7 for you. They never take a break. They're constantly protecting you, pulling in the very air you need to survive. So the real question is, what are you doing to protect them?